For the patient with lower cross syndrome, we're going to focus on soft tissue mobilization of the overactive structures. Now, the two major ones that we want to consider are going to be the lumbar erectors and the iliopsoas. For the lumbar erectors, I tend to adjust my patient's inside posture, so I tend to do the soft tissue there. That way I can just move them right into the adjustment. A lot of doctors will have the patient seated over the end of the table and pin and stretch as they flex the patient forward there. That's a great technique. Some other doctors will also lay the patient prone on a flexion distraction table and use that for pin and stretch. So there are a lot of different techniques that you can use. The one that I use here, I'm going to bring the patient into a side posture position in order to allow me to control the pelvis in a way that creates the posterior tilt that's going to increase tension on the lumbar erectors. Then I'm going to go ahead and take a contact with my fingers through the lumbar erectors. So I'll be raking through the lumbar erectors while I apply the tension to the thoracolumbar region. I'm going to then use my superior hand in order to create flexion of the thoracolumbar region in order to further add to that tension. You'll notice that as I do these techniques, I work to keep myself upright. If you get too bent over, aside from laying on the table, it's going to put a lot of stress on your lumbar spine as well. You don't want to hurt yourself. And so we're going to go ahead and rake through these structures while trying to keep ourselves upright. And you'll notice I'm using my hip to create posterior pelvic tilt on him in order to increase that tension through the erectors. For the psoas, I'm going to have the patient flip over. I'm going to use my thigh to stabilize the sacrum. And then I'm going to flex the knee and extend the thigh while getting right on top of that psoas. So I'm going to come about an inch medial and an inch superior to the ASIS, stabilize on that sacrum, and then I'm going to pull that thigh into extension while I pin on the psoas proximally inside that ASIS. As you pull back, you'll feel that psoas pop underneath your fingers to create the tension. And then with each sweep, I'll move proximal into the abdominal wall in order to get more and more of that psoas. One of the things to watch for when doing this technique, if your patient has a tight iliotibial band, that femur will tend to drift up. You may want to try and hold it in more of the sagittal plane as you bring that back.